Hello, everyone. Welcome to this seminar. It's time we talk about patient engagement, organized by the European AIDS Treatment Group, European Patient Forum, EATRIS, the European Infrastructure for Translational Medicine, and EULIFE. We're very happy that you are all here, and that we have for today a great panel for discussion and a great keynote speaker. We are organizing this seminar primarily for researchers who are looking into patient engagement to get started with it, for people who may want to look into better resources to get started, and to have a discussion about how to start with patient engagement and to make it meaningful. First, some practical information and a short welcome from my side. My name is Marijn Huiskamp. I'm community officer at EULIFE. We're an alliance of 15 research institutes in Europe advocating for research excellence. We do that by exchanging knowledge between the different institutes on how to best manage a research institute. And we go into Europe to influence European science policy. Yeah, there's a little bit of information about me, but let's move on to the next slide. Some housekeeping messages. I think the first one is very speaks for itself. Please be respectful online. Use headphones and earphones. If you want to contribute, which we very much hope you will do, you can use the Q&A box to type your questions, or raise your hand if you'd like to ask a question. During the panel, there will be a dedicated session in which we invite you all to contribute. But if you would like to type, that's also fine. Then use the Q&A box. If you have technical issues, only then use the chat box. For all the other matters, use the Q&A. That's it. And then we can go to the agenda that we have for you today. In a little bit, I will give the floor to Elise Kaidong from EATRIS, who will give you a short introduction on the Patient Engagement Resource Center that they recently launched. We will have a keynote presentation from Sophie Beccard from the VIB in Belgium. Then we have an excellent panel for you, chaired by Valentina Stramiello from the EPF. And finally, we'll round off with some concluding remarks. Before I give the floor to Elise, there's something we want to ask you. We're very curious whether you, as an audience, are already engaging patients in your research. So we should be able to briefly see a poll for that. There it is. Yeah, we would be very curious to know whether you are already engaging patients in your research. Maybe not yet, you want to, or maybe there are some things that, some obstructions for you. Maybe you don't know where to find the right resources, how to get started, don't have the right enough time or resources to start with it. So if you're able, please give us your vote. I'll give you a couple of seconds to respond. And then in a little bit, we should be able to see some results. If possible. Please let me know when there will be the answers. Yes, there we go. Perfect. Okay, this is very interesting. Here we see that about 55% of the respondents are already engaging patients in their research. That's great. So we have a very expertised audience here. So it would be great to, in the later session, when there's room for questions and answers, to hear from you for example, what you're already doing, or maybe some issues in your patient engagement activities that you might be running into. At the same time, there's also a large part of you that is not yet engaging in patient engagement, doing patient engagement, but would want to. So that's also very interesting, and we will definitely be able to look at some practical steps for you to take. So we'll take that into account. Thank you very much for answering. And then before we go over to the next session, one last question, and that is if you feel that there are enough resources for you to start in patient engagement, and whether these resources are easy to find for you online. So that's the second poll question that we have for you, which should also be visible very soon. There it is. So this is specifically about the support materials. If you want to engage patients, do you know where to look, where to go, where to find practical information? Maybe you do. You're very happy what is out there. You're already pretty set. Could also be that the choices or the information available is a bit overwhelming, or maybe you are not so happy with what you can find online. You have trouble finding what you need, or you don't really know where to start, where to look. So also here, please let us know your preference, your situation at the moment. Give you a couple of seconds to give your opinion here. And then this question is, of course, a nice bridge to the second part, of which with which Elise will introduce you to. But let's have a look at the answers first. There you go. All right. Well, what we're seeing here. So the largest part of respondents of you are saying that you have some trouble finding what you need. That's very interesting. Also, a large part, 27%, don't even know where to start. Well, that's also great to hear. Hopefully, we can help you with that. And also, quite a few, 28%, say that it can be overwhelming where to start. So, a more structured, more clear overview of what's available online would also be very welcome. And the smallest proportion, but still 15%, say that they're happy what is out there. That's also encouraging that a part of you already know where to go. With that, I would like to give the floor to Elise, Member Engagement Officer at EATRIS, who will now introduce their resource center to you. Elise, go ahead.
Thank you, Marijn, and thank you everybody for joining us today. My name is Elise Keidank, and I'm the Member Engagement Officer at EATRIS. EATRIS is the European Research Infrastructure for Translational Medicine, and we group over 150 academic research institutes across 14 European countries. And our mission is to accelerate scientific discoveries into patient benefit with the shortest amount of time possible. EATRIS has made patient engagement one of its priorities already since 2019. And we do believe that as a representative of academic groups, we really have this sweet spot to build bridges and connect academic researchers with the patient groups, and therefore provide support in the process of normalizing patient engagement in research practices. One of our flagship projects that's been running now for 4 years and is concluding at the end of this year had patient empowerment as one of its objectives. And through this project, we developed the Patient Engagement Resource Center that I would like to present to you today. So in a while, I'll share my screen, but a couple of words. Since early 2022, we've been working with EPF and the ATG to develop this resource center. And it's been also developed in co-creation with many different stakeholder groups, academic researchers, research management staff, patients, of course, caregivers, research funders. We've run many workshops and focus groups and task force meetings. And we think that such stakeholder engagement really helped us to ensure that this resource center is fit for purpose. So without further ado, I will share my screen. I hope this works out well. I hope you can see this. So this is the Patient Engagement Resource Center. It is a one-stop shop to find resources to support academic researchers to get started with patient engagement. So in the development process, we quickly realized that there's a lot of really good material already out there, and we didn't want to fragment the field any further or create any further confusion. So we decided to create and curate the resources that are out there, but to organize them from a point of view that really would make sense for scientific researchers within their process. All of the resources are actually available right from the front page. So they're divided into these 4 categories: fundamentals, planning, conducting, and follow-up. And they are further categorized based on what kind of materials they represent, either general guidance or training or practical tools. They're in the fundamentals section. As many of you I saw also in the poll responded that there's a lot of materials available, but it can be really overwhelming. So over a quarter of you responded this. And therefore, we actually created the sort of starter pack here with 5 resources that we think are really the fundamentals that you can use to get started. So a little bit more about the resource center in terms of, well, we didn't also mean it to be just a table of contents with already existing resources. We also would like to inspire people to do more patient engagement, and therefore we interviewed some researchers and patient duos who have successfully engaged in patient engagement, and we recorded 3 videos. For some reason, the internet, I think, is a little bit slow, so this page is loading. I hope it will pop up soon. In any case, these pairs of researchers and patients discuss their experience and also share some tips indeed. So the stories page is here. I really encourage you to check this out and yeah, get inspired. Furthermore, we also have the FAQ page. So the FAQ page is not only about the resource center itself, but it also contains some questions about patient engagement in general. What is patient engagement? What is not? Also, who you should engage, when, how, and if you want to distribute the resource, how you can do this. The Patient Engagement Resource Center is a live resource. It's a community resource created with the community and meant for the community. And we also would like everybody to contribute. If you think that something is missing, we really encourage you to get in touch. So there's a get in touch feature through the website. You can suggest missing resources, or also if you know of really good stories about patients and researchers working together, we would really like to hear about it. So please, you can also submit some further stories to us through the website, or just get in touch, ask questions, and we will be there for you to answer these. Maybe last but not least, I would also like to say that some input from our patient community in terms of the accessibility of the website, we found it was a very important thing to implement. So there's also accessibility features to make it a little bit visually more friendly. You can change the text size on the website, and yeah, it's all mobile and accessibility responsive. I think with this, I would like to conclude, and I really hope that the people who responded in the poll, that there's a lot of resources out there, but can be overwhelming, or you have just trouble finding what you need, or you don't even know where to look or where to start. This resource will help answer some of those questions. Thank you very much. And with this, I would like to give the floor back to Marijn.
Thank you, Elise. That was a great demonstration of a very much needed tool, as we saw from the poll. Indeed, I encourage everyone to check it out. With that, I want to introduce our keynote speaker, Professor Sophie Bekaert. She's a professor at the currently manager translational program and head of communication strategy at the Flemish Inter-University Institute for Biotechnology, the VIB. She's also coordinator and part-time senior lecturer at the Faculty of Medicine and Health Sciences from Ghent University, with ample experience in preclinical translational research, and we're very excited to have you. So, Professor Bekaert, please take it away.
Thank you so much, Marijn, and thanks for the organizers for inviting me, because I think, and you already saw it from the poll, building a coalition of the willing to step into the patient engagement and involvement scene is so important. So from a very humble and modest position, I just want to share some experience that actually our experience on patient and stakeholder engagement within our VIB Grand Challenges program. The next slide, I actually cannot manage. Yeah, okay. So what is VIB, the Flemish Institute for Biotechnology? We are as a so-called strategic research center in Flanders in Belgium, and we're focusing upon all, I would say, molecular processes, the molecular background of living organisms, with, of course, the aim of translating our knowledge and our assets into practice, both for I would say the biomedical field and everything that deals with sustainable agriculture. But the focus, of course, is patient engagement today. VIB on itself is also like a classical research center focusing upon forward translation, starting from ideas, starting from knowledge of scientists and translating it to practice. With the Grand Challenges program, we started it around 6 years ago. We wanted to change the paradigm, and we really wanted to bring in the systems thinking approach, meaning that we also, besides the forward translation and research and development, we wanted to start from the unmet needs, from the problems in practice, and translate those back to the lab to see whether or not we are missing some of the tools and the expertise, and whether or not we are missing perspectives from stakeholders to really come up with very tangible solutions that actually have a big added value for society. And that was actually the start of the Grand Challenges program, very much inspired by the Sustainable Development Goals as they're depicted there. And next slide. So in terms of a systems thinking approach, what I find very important for this audience, as a researcher, you're focused upon your research. You're focused upon your research problems. And defining or what the unmet need is that you're trying to solve with your expertise should be more than just a narrative to, for example, obtain some funding for research projects. And we believe, and this is what we really integrated in the Grand Challenges program, we believe it's really valuable and necessary to think about unmet needs from different perspectives. The functional need is something that's the functional unmet need is something that a researcher is really much acquainted with. It's everything that deals, in our case, of the molecular makeup, the molecular mechanism, the tools you want to use to solve some molecular or to get some molecular insights. But it's as important to also think about whom are the potential users, and not only end users like patients also, whom are the intermediary users, who actually might benefit from the assets, the know-how, the knowledge that we are building as researchers. Because thinking about those stakeholders will also open opportunities to meet better the unmet needs, and also to have a bigger scala, I would say, a bigger regiment of potential added values as well. And that's more difficult often for researchers, but within our Grand Challenges program, we actually assist and facilitate the researchers to also think about accessibility. It's one thing to think about a new or a better diagnosis for a certain disease and think about what it might mean for patients, but it's also as important to say about, will it be fundable, will it be realistic, will it be accessible, and is this really the way forward as the best solution? So thinking about accessibility before actually or while concepting a project, but also while conducting a project, can help, as well as the policy and regulatory frameworks and contexts that are needed actually to translate your assets as a researchers for the better good of society. So we actually integrated that within both the selection procedure, but also the conduct of the Grand Challenges project. So the next slide. And then actually it's all about perspectives. And I really like this story on the seven blind men and the elephant. If you just put seven blind men next to an elephant, depending on where they're standing, they will have a complete different idea of what an elephant looks like. And this is what I actually try to explain also with the unmet needs, with the stakeholders, with the users and the end users. It's really important to try and understand the whole system and all the different perspectives that come into play. And for doing that, and that's the next slide, we really have to also bear in mind that that's important to think about what means and what methodologies are appropriate to reach out to users, end users, intermediary users, and any stakeholder that could actually help assess those unmet needs and solve them or partially solve them. So often what I see, and I call it kind of tokenism too. It's like, okay, we have to do something with stakeholders, we have to do something with patient engagement. So, we will make a leaflet or a website and we will explain what we will do. This is information, and information and raising awareness is very important, but it's not an interactive thing. It's something very straightforward. And I think it's essential, but it's only one element. So if you look at participation in a stepwise approach, from information to maybe also try and strive for an interactive methodology of reaching those stakeholders and patients, and maybe then also involve them in an active way, and maybe go to collaboration and empower them. For each of these steps, it's really necessary, I think, for those projects that maybe are not like this. Or that are mission driven, like the Grand Challenges project, to really think about what activities would make sense, and what activities won't. And that's the first exercise that's really pivotal and important. Mm. So the next slide. Excuses. So this is just, I wanted to make it concrete. And this is, for example, how we tried, um, for each of the projects, to create a toolkit of information and communication, I would say, assets to explain what the projects are about. We also have um, developed some of those communication means after an interaction with stakeholders, with patients, to better understand what kind of information do you need. Because also information, if it comes from scientists, it's often also biased by their view on the unmet need, and it should be broader than that. And also think about, indeed, and I really like that in the Patient Engagement Resource Center, also think about their abilities, think about what is actually the most accessible way of giving that information, whether it is digital, but it might not be the best thing for each of the stakeholders, whether it is something physical but interactive, so that you really attract them and try to engage and involve them. Maybe the next slide. So the next step then is involvement, and we call it involvement. It's, for us, it's more than engagement. It's really consulting them. And when you want to consult a patient, um, often if we use some methodologies, we call it reverse science cafes, what's in a word, but it's like switching roles. We're a reverse translational program, so we also want to do some reverse interactions, meaning that we step down from the ivory tower and we really go into very small focus groups, discussion like approaches, where we give patients and other stakeholders a very safe environment to be open and transparent. And so, just to give an example, for researchers, often it's like, yeah, but we're not used to that. If it's a basic scientist, they never meet patients, and we are really convinced after these 6 years that it's so important and it's so much added value to kind of force them into an interaction, but really also for them in a very safe environment. So the reverse science cafes that we organize together with patient organizations are actually meant as a way to better understand, so to step down as a researcher from your expertise and to be the one from a naive standpoint saying, okay, actually, I want to learn more about you and your unmet needs, and I want to understand better how I can meet up to those needs. And this is, for example, an example where we had a project on immune deficiency, and we organized a family day together with a patient organization, and we wanted to understand where, besides the research we were conducting, we could do better for them. And it was amazing. I forced kind of our researchers to step into those dialogues, those focus groups, and they were like hesitant, saying, I feel awkward. I'm not used to that. But after an hour, they came back, and that's always happening. And they came back and said, this is giving me the energy and the resource source to continue my research, because now I better understand what the burden of the disease means, but also how we actually could be more accessible for sharing information and thoughts and so forth. And this resulted in, upon request of the patients, in patient documentaries for small children and teenagers, where they actually, with a vlog camera, explained what they actually encounter having the disease, but from their perspective and upon their request. So that is one of the results of such a reverse science cafe as we feel it. And then maybe the next slide. But it can be also at different levels. For example, for a project on spondyloarthritis, we we also, because of the unmet needs, we wanted to understand what are the health economical consequences of the project and the results of the project that we are putting forward. So we included health economists, but then that's something that often patients are not really much acquainted with. So we dare to also have an interactive cafe on health economy and how actually patients, what kind of information they needed or what they need in terms of um, what is price setting, what is cost benefit, how can we have a say in it, or can we have a say? So also there, I think it's another way of another example, a concrete example, where we actually learned a lot, and again, where the researchers as well as the clinicians were really pleased with the fact that they could, in a safe environment, have this interaction. So maybe the next slide. And I have to say this because it's about patient engagement, but I still believe that it's very important to also think upfront whether or not it's already a good moment to reach out to patients. It might as well be more important to reach out to clinicians in a first stage as an intermediary stakeholders. And also there, think about other ways and see it as a step-up process. Have an interactive moment with clinicians, understand their concerns and needs, and then organize also a moment with patients and try to engage them for a longer term. And I can tell you, once you step into that patient engagement initiatives, you build kind of ambassadorship with patients and clinicians and other researchers, but you also build a long-standing relation, and I think that is as important. And then the next slide, and I think I'm nearly at the end. So yeah, this is just a complete other example, and I avoided to talk about clinical trials and inclusion of patients because that's something completely different, I believe. But also the perspective of citizen science, it shouldn't always be patients. I think it's also very relevant to think upon how to engage citizens at large and really strive to define some citizen science, citizen participation initiatives links to running project. This was one on soy as a protein alternative to meat, where we actually engaged more than 1,000 citizens to grow soy in their garden as a way to understand how actually not only to acquire knowledge, but also to understand what interventions as a research organization have an impact on, for example, their opinions, their attitudes towards sustainable agriculture. So it's also something relevant to think about. And a last point I want to make, so that's the next slide, is also be very creative, and please do be creative. I'm really a believer from that in the ways you want to bring information and the way you want to interact with stakeholders and with patients. And we dared actually to step into an art science project together with two museums in Belgium. And we introduced our research and our researchers to those museums and to artists, and they could step into a project where they designed together artwork. And it's a very interesting way. It's just something that I couldn't leave out of this presentation. It's a very interesting way of interacting and actually coming up with some very teasing output, whether it is something tangible or a text or whatever, but really explore that. I can only advise you to do so. It's really interesting, and it attracts and it will engage even more stakeholders. So with that, I think I actually have said what I wanted to say, and I'm more than willing to answer some questions also during the panel. Thank you so much.
Thank you, Sophie, for your keynote presentation. We will now start a panel discussion, but before that, we would like to launch a new poll, which is coming to the screen very soon. And while we wait for the poll to come up, I will share the names of the panelists. They are Zoe Gray, Deputy Director for Public Partnerships at the National Institute for Health and Care Research in the United Kingdom. We also have Dr. Emma Doris, a Program Manager for Public and Patient Involvement at Ignite Network from the University College Dublin, and Elizabeth Vroom, who is the Chair of the World Ocean Organization. And here you find the poll on the screen. The question is, what aspect of patient engagement do you or would you find the most challenging? And you have a number of options to respond. Okay, I hope everybody had a chance to react. Hopefully we will get a response soon. And in the meantime, I will invite our panelists to join the conversation. So let's see the reactions. Up, please, thank you. So addressing patients' expectations is one of the most challenging aspects with 45%. Educating researchers on the added value and process, 46%. Dedicating time and human resources to make the engagement happen, I guess, 54%. And building long-term collaboration, 40%. So it feels like most of the respondents reacted to more than one option, which makes sense, actually. And that's because there are indeed the multiple challenges to be addressed. And I think these maybe also can help the conversation, because our panelists will also be given the opportunity to share some tips from their own experience. And with this, I would like Zoe, Emma, and Elizabeth to start also share their own first reactions to Sophie's presentations. Emma, would you like to start?
Sure. Hi, everybody, and thanks very much, Sophie, for that presentation. I found it really interesting. It's always great to see the overview of how different regions approach this. I suppose one of the main take homes, and it's something that comes up repeatedly, is the difference in language that we use. So you had up involvement equals consultation, and we in Ireland have a very clear distinction between consultation and involvement. So I think David put that question in the chat as well. So it's always really interesting. And if there's one point people take away, it's not to focus as much on the language. It's not about what you call it, it's about what you do. And it's something that comes up again and again, but to all the researchers out there confused, consider what it is that you're doing, not what you're calling. And I think that's an important point. Yeah.
Thank you, Emma. Very concise and to the point. Zoe, please.
Thank you. Yes, I also found it a fascinating presentation. And I suppose the one of the things that struck me was about the value of engaging all of the different stakeholders and really focusing on that from the outset. What will they get from this during the process of the research and at the end? And I suppose I'd have a challenge to Sophie in terms of what she said about kind of the separation out of the patients and the public and the clinical professionals. Perhaps you need to do that from the start, but there is real combined value in finding a way of working together. You get new ideas that you would never have got by separating out the different stakeholder groups. So that's one thing I would say. And then the other thing was, this really struck me what you said about reverse science cafes and that need to step down from us being the experts. I think that's absolutely fundamental to effective patient involvement, actually. And it's one thing that in the UK, it really came to light during, we were working on long COVID platform trials. And in long COVID, the only people with the experience and the expertise of the disease were the long COVID patients. So it forced the scientists to take a different role. So I think the more we can do to engineer that shift in thinking about expertise, the better.
Could I maybe briefly react to that, Valentina, if that is okay?
Yes.
So thanks also, Emma, and thanks, Zoe, for your thoughts. And Zoe, you're fully right that the true value is really in having, I would say, or taking the time to bring everybody together. And what I wanted to add there, and that's very important, I talked about patients and clinicians, but scientists, basic researchers have a very important role to play there. But in a certain way, they bring a lot of trust and confidence in these kind of discussion, because often patients towards clinicians, it's like, yeah, but I'm not hurt, and then the researchers has a completely different perspective, and then you see patients, reaching out to them, and maybe you can help me, maybe you can better explain it to me. So I think there's a true value. I just want to confirm that. Yeah.
Thank you, Sophie. Now I would like to give the floor to Elizabeth to also share her first reaction.
Yeah, thank you. Thank you for your presentation, Sophie. Very, very interesting. Yeah, well, my first reaction is, and you won't be surprised if I hear things like step down from your tower. I think, which tower? I mean, if you are a scientist and tomorrow you're ill, do you fall off your tower to a local tribe? I mean, what are we talking about? And I think that kind of wording should also we shouldn't use that anymore. The same and I love it. It's not my own, but somebody said yeah, and then people speak about patients should sit at the table as well, but it is our table. What are you talking about? And I think that is the mindset and the whole thing, because I saw, you won't be surprised, I come back to that one. The lowest one in the last poll was, yeah, if we only had time and money, in fact, right? That is nonsense. It's the mindset. If you want to involve patients, you get a lot of time back. What money are you talking about? And maybe you invest 15 minutes of your own time every now and then. I mean, it's not a lot. And it's very nice you organize these cafes, but for the ones who didn't know, I come from the Duchenne field. We have scientists, clinicians, everybody, patients come to meetings like Patients Day, conferences, And then it's just together, like, what are the problems? Can we solve them? And of course, with citizens, it's a little bit more difficult, as you already said. But even there, I was surprised. We were very much in favor, for example, of reuse of data. Duchenne was one of the leading groups in the reuse of data. And then the story was, no, that's not what citizens want, you know, and whatever. And then we just hooked up with the Netherlands Institute for Health Service Research. They have a panel, they did a poll, and we had the answer, you know. So there are a lot of ways to get information, and not necessarily like first we need you know, 500,000 funding and then we can start thinking about it. So that's what I wanted to say. Yeah.
Yeah, Valentina, if I can react to that, I fully align with that. And I want to put it bluntly in terms of stepping down of the ivory tower, because you're fully right, but it's a trust building process. And before you get there with everybody in a balanced way, in a balanced interactive way, you have to step down. Because what often happens around that table, even if it's our table, it's the expert who start explaining what it is about with very difficult words. And that's for me stepping down. You switch roles. I'm now the humble. I know what I'm talking about. I know my expertise, but I want to listen to you. And that's what I really want to mean. And yeah. Voilà.
Thank you, Sophie. Before we move to the next round of questions, I have one from the audience. It was Marie Barnes who asked you, Sophie, whether you started with a small team, how were you able to make things start, maybe having a small team, having a few capacity, and this resonates a bit with what Elizabeth was saying. So how would you make it work?
Yeah, indeed. It's not that we have hundreds of thousands of euros to spend on that, but it's also it's a mindset, as Elizabeth was already saying. It's trying to integrate it in all your activities, and it starts with the harvesting of the project, discussing with the scientists on, yeah, but have you interacted? How can you interact with patients or other stakeholders? That's the first step. And even in the selection process, that's also something that you embed. It's not an activity, but it's really essential to embed it. So we have a very small team of 4 persons who are leading the Grand Challenges program. And the activities like the reverse science cafes, the communication, anything that we do there, we really want to join the forces, and we join the forces with like patient organization, with other stakeholder groups, and we surf along on, for example, if they have a patient day, if there is a symposium, if there is an event where we actually are already can share the efforts and resources to organize something like that, but we focus upon the content, and then it's manageable. That's one thing. And also helping research basic scientists to get the burden away from them. We can look for the methodologies, we can share the best practices and share them with them and facilitate, and that's feasible, but it's about sharing, and I think initiatives like today and also the patient engagement resource, this is what it's about. It's sharing also our resources and our efforts.
Thank you, Sophie. Now I would like our panelists also to share their tips, and I would start with Zoe. I'm aware Zoe has a few slides to share. We have to be very concise because we are running out of time already, but I see the conversation is very lively. So feel free to take the floor.
Yeah, that's great. Thank you. So you've seen that where I'm from. And basically my role is leading for improvement of what we call public partnerships work across NHR and with our partners. And if you weren't aware that NHR funds £1 billion worth of research domestically and also global health research in every year. And it's about health, public health, social care research too, that leads to improved outcomes for patients and the public and makes the health system more efficient, effective and safe. So I can move on to the next slide. So in a nutshell, working with patients and the public in the creation and use of research really hits right to the heart of NHR's agenda to have impact with its research. So we have loads of evidence showing that we can make improvements in the relevance, the quality, impact of our research, and the potential about improving rates of enrolment and retention on trials. At the centre of this, though, our work is funded by taxpayers. It's their democratic right, and we've just heard very clearly from Elizabeth, to be shaping and getting use from research linked to their health and care services. And in this post-COVID world, we are more acutely alive to health inequalities, those who have missed out or experienced harm even from the health and social care system, which doesn't meet their needs. So research plays a key role in addressing that, and it needs to involve the most effective. I've already mentioned about long COVID platform trials and what that taught us about expertise. So on to the next slide, please. My small team work nationally mainly, but also we collaborate internationally, and that's about stimulating change with and through the wider NHR and its partners. Our role, 4 things really: leadership, coordination, challenge and support. There are 200 or so roles across the NHR who have a role in leading or facilitating public partnerships. They do the work on the ground, and we help to bring them together and to enable them to improve what they're doing. So some examples of what that looks like on the slide: we provide tools and guidance, fairly similarly actually to the PERC, in terms of the Learning for Involvement website, where you can find and upload guidance and good practice. We run events for researchers and public engagement leads. We implement strategies and frameworks. We were a key initiator, for example, of the public involvement standards created in partnership of the UK. And we prioritise that importance of working as a wider system, because encouraging consistency and a stronger voice together means that we can start to tackle the cultural change, which is what makes things stick over time. So whilst NHR has had public engagement as a requirement of funding for some time, it still recognises it has significant work to do to make sure it's consistently effective, not tokenistic, and really impactful. So on to the next slide, please. So basically, one of those areas that we really need to focus on at NHR is making sure that people and communities who are most unserved by and unheard by research increasingly shape, deliver and use it. And basically what this slide takes in public engagement across the research lifecycle where it happens, and highlights that essentially we undermine the potential benefits of public engagement if there is a lack of diversity in the people and communities we work with to create and use research. So moving on to the next slide, you can see that why we've come into this area a bit more. We realise that the imperative of diversity means we need to work differently. We have to improve cultural competence of organisations and teams and get closer to communities. So one of the strategic initiatives we started 2 years ago, co-designed with a group of Black African, Caribbean heritage and Asian people, is to develop a framework and a tool which enables organisations or researchers to critically appraise what they can do to move forward on race equality and public engagement, to put actions in place and to monitor their success. Why did we focus on race? Because the house is burning down or has burnt down. You know, there are other issues of equality, we know that, and there are also applications of this race equality framework for other areas of intersectionality. To date, this framework has been adopted officially by over 21 organisations, and that includes industry organisations like Roche, universities, health providers, and it's used by many more. And we support those organisations as they tackle the challenges they face in this work through a community of practice and action learning sets. And we have public members that actually initiated and did this work, trained as action learning leaders themselves. So they're kind of leading a lot of the work and the events with us. If I was to say a hint or a tip to the audience, you're going to probably hear this come up a number of times. I'd say there's 3 things I'd like you to take away. Time and place, to plan your work, to find people going where they are, to build relationships in advance of specific work, to understand motivations and goals, and not to put people in the business mold that you have to do things when you're available. Relationships, start early to build, spend more time listening and learning. And that means outside of formal meetings as well, keep in touch, treat it like you would an important relationship outside in the real life, if you like. And then valuing people and making it easier for them, you know, recognition and reward and support are a really big deal, but they're different for everybody. What does everybody need? What's going on in their world outside work? And how can you help? And that often doesn't involve a lot of time and money. So that's it from me.
Thank you so much, Zoe. Now I would like to give the floor to Elizabeth to share her own experience in patient engagement in preclinical research. I know you have wonderful stories to share, so feel free.
Thank you. Yeah, well, of course, this is a rare disease, which is always slightly different from more common diseases and public things. But one of the things I really would love to start with is that if you see focus groups, you know, that's nice. I saw it in your presentation, but it's kind of to test the water. You know, it's a first step in patient engagement, but you don't get really the outcomes you might want to have, you know, from a larger group. But one of the things we, for example, in Duchenne do, and which is very successful, are the community advisory boards. So from 12 countries, there are patient parents representatives. The interesting thing, and that's why I mention it here, is that companies come and researchers don't. And why don't they come? I don't know. They're free. I mean, they don't have to pay for it, where industry might pay for this kind of services. But community advisory boards is really something to look out for. I know it's not there for every disease, but not in Duchenne, it definitely is. Everybody knows still, we don't see a lot of researchers coming. Of course, the storytelling is super important. The risk, I mean, we have done also things like videos and so on, is that still people try to steer these by the questions, these storytelling. So if you do a storytelling, let somebody really tell their story and not already ask the questions. Like, I remember my son, he's now in his 30s with Duchenne. When he was 12, he was interviewed, and every time they said to him, "Isn't it terrible you can't walk anymore? Isn't it terrible you can't walk anymore?" Till the point he said with a big smile, walking is highly overrated. And I think that these are things, when you do these videos, you have to make sure that you don't put the words in the mouth of the people. So that is, storytelling should really come from the patient, I think. I think you already mentioned the multi-stakeholder meetings. They are super important, but also to report on them, not only to have them, but make sure you write them down so others can find them. And that writing down is for a lot of things. Like, for example, in Duchenne, we have a certain subgroup of patients. A lot of drugs are developed specific for that group. So for research, the question is, and also for industry, how should we make decisions? And then we sat together with a whole group of, it was the initiative of patients, in fact, but together with clinicians and others, to write a paper about that problem, just to discuss, like, we see this problem, how can we solve this? And then by writing it down in a balanced way, it also helps others who have the same problems. And I won't go on too long, but also about the burden, I think, and ethics committees tend to be the ones who tell you what's the burden, right? But at the end, it's the children, especially when it's a pediatric population, where there has been done good studies, like 8 years ago, 10 years ago, what children perceive as burden in clinical trials, for example. But there's hardly anybody looks at it. So it is still, that is something, to me, it's incredible. If you treat a pediatric population and you say what you see as a burden, well, the kids really see totally different things as a burden. So I think also for scientists, earlier on, whatever, just think about what's the problem, what's the burden of the disease, but also what's the burden of treatment. And then last but not least, I think the outcome measures, if you work towards research, clinical research, the outcome measures should also be in line in what is relevant to the patient. And it sounds as an open door. It sounds like, of course we do. Well, I can tell you, it's not. It's not. So patient preference studies are of the essence, but also every time to discuss again with the patient what would be best for you. Interestingly, in the videos, we did videos on boys with Duchenne who were non-ambulant. Just ask them, like, what is most relevant for you? So everybody thought that they would say, oh, I would walk again. No, the most important was putting my arms on the table, be able to put my arms on the table. And then we developed outcome measures, patient-reported outcome measures, all based on these series of videos of boys of different countries. So with that, I think I said enough, right, Valentina?
Thank you. Thank you so much, Elizabeth. And then, Emma, it's your time to share your story and tips.
Great, thanks a lot, and it's been great to hear everyone. So for those of you who don't know me, my background was in translational research. So I worked as a researcher in this field for about 10 years after my PhD. And so I have direct experience of involving people in translational research. And to be honest, it's a very different process from a lot of the ways that people are involved in other types of research. So, for example, a more patient-facing research, because it is not a natural part of our training as researchers, and there is, I would say, in some ways, more groundwork to be done because our research isn't as accessible as it is in other places. But to me, the reason that I do, and the reason that I now full-time work in the area of public involvement in research, is because it's about maximizing the potential of research. And I think every researcher out there, they want their research to be used. And fundamentally, if we don't understand the disease area that we're studying, how things could potentially be used, even if we're a number of steps, you know, way down the pipeline before it ever gets into use, better understanding of its potential for use and considering those factors as we are doing our research can only be beneficial to the research outcomes, and the likelihood that that research will eventually be adopted. And that is, I think, something most researchers can relate to. But understanding that and then operationalizing that are two different things. So time and resources came up, and it's really interesting because one of the first studies we did this with biomedical researchers back in 2018, this also came up, and it comes up again and again. And I think it's not necessarily the time and resources, but it's the value that our research system gives to public involvement that then makes you decide where you put those time and resources. So there is an area for our systems and our academic systems to value this more. So for example, I'm very lucky to work at the university I do, where actually public involvement is part of the faculty career development framework. So if you engage with this, you are recognized and you are acknowledged, and it is part of the promotions aspect. This isn't the same across the board in many other institutions. So there is an infrastructure element as well as having the skills and the drive from the patient community side and the skills and the drive from the research community side. There are infrastructure issues around it. And I think it's important that we call those out and are aware of those so that we can actively work through them. And like what's been coming up again and again, there are some places where these have been addressed. And I think that sharing of the knowledge and how it's being addressed is a really important aspect. So anyone who is relatively new to the field, look at places like the PERC, the Patient Engagement Research Centre, looks at places like the PPI Ignite Network at the NIHR in the UK and various different places. There is lots of information there available to you, and also reach out to other people. I just wanted to give one or two examples of how public involvement has benefited directly translational research projects, because sometimes it's difficult to kind of put it in context. And one example is where I was working with a group of researchers and they were doing single cell sequencing. So they were looking at one context versus another, and they identified two really good potential gene candidates that they were interested in bringing forward to study. Scientifically, going forward with either of these gene candidates was absolutely valid. One of the genes was really well characterized in a different disease area, so the likelihood was that it would probably get positive results for the research team, but add only a very small amount to the overall knowledge and reality of what we were looking at. The other one didn't really know anything about it. There were materials where you could investigate it, but it really wasn't well characterized. So it could have been hugely influential, or maybe no effect really. So they brought in this was a big part of a discussion with their patient research partners, was around which avenue they go, because the decision wasn't necessarily a scientific decision. Both were scientifically valid. It was a risk-benefit decision. And it became really, really rich discussion around which area they actually go to. And there's loads of discussions like that where it's not scientific decisions we're making, it's wider decisions we're making. And that's where, if you've built up those really rich relationships, you can capitalize on the bigger picture and make better decisions. So I think I've spoken a lot around that, but there's plenty of examples like that around. So I'll pass it back to you, Valentina.
Thank you so much, Emma. And we are moving towards the end. But before that, I wanted to share some questions that we got in the Q&A section. And basically, this is question coming from patient advocates asking how they can contribute. The way you can contribute, for sure, when it comes to the PERC, is to promote it. This tool is meant mainly for researchers, preclinical researchers, because when we started the work together with the EATRIS team, we thought there are already plenty of tools for patients and patient advocates. If we look at, for example, the EATRIS platform, plenty of material is already available there. While with the PERC, we really wanted to address the specific needs of the preclinical research community. We believe patient advocates, patient advocacy groups can be big supporters in promoting this tool, and this way promoting patient engagement in preclinical research. With this, I will give the floor back to Marijn. Thank you, and sorry for being a bit late.
Thank you, Valentina. Then I would like to move on to the concluding remarks. I think there is a lot more to talk about, and I've really enjoyed the lively discussion. To not go over time too much, I just want to first and foremost thank our speakers and panelists, Sophie, Zoe, Elizabeth, and Emma. Thank you so much for your valuable contributions. It has really broadened my view on patient engagement. Some takeaways that I had was really to start anywhere, to start small. It's not so much, like you said, the time and the resources that are the limiting factor, but you can just you can go ahead. And of course, as scientists, you might be inclined to start with information giving, which is valuable, but think broader. The consulting and the involvement really broadened my view on ways to involve patients or citizens in a broader sense. Listen to them. I also really like the comment on the community advisory boards. I had also not thought about that before. And I totally agree. That's one of the points that Emma made, that the scientific community should value this more. And I think you are well on the right track in advocating for this. So with that, I want to thank you all. Also to all of the participants. Don't forget to check out the Patient Engagement Resource Center. Elise put the link in the chat. And when the Zoom closes, there will be a few survey questions. So we would really like to hear your feedback. And with that, I wish you a great end of December and holiday season. Thank you so much.